Eminent Chancellor, on behalf of the Senate of the University of Alberta, it is my privilege to introduce Ruth Collins-Nakai for the honorary degree of Doctor of Science, our institution's highest honor. Dr. Collins-Nakai is a true leader and a credit to the medical profession. She's a cardiologist who has spent more than 30 years at the University of Alberta as a professor of pediatrics and associate dean of the Faculty of Medicine and Dentistry. She broke many boundaries throughout her career, serving as the first female president of a number of organizations, including the Alberta Medical Association, the Canadian Cardiovascular Society, and the Inter-American Society of Cardiology. She was also the first Canadian and first woman to chair the Board of Governors of the American College of Cardiology. One of her early initiatives as president of the Alberta Medical Association was to help bring in seatbelt legislation, which has saved many lives. She also took a motion to the Canadian Medical Association that led to Air Canada becoming the first airline in the world to declare its environment smoke-free. Affectionately known by many of her patients as Dr. Ruth, she established the Heritage Pediatric Cardiology Program, the precursor to the successful congenital heart program at the U of A. She also introduced ultrasound of the heart there more than 4 decades ago and helped establish the infant heart surgery program. Dr. Ruth has worked on national and international projects ranging from physician resource planning and healthcare financing to federal-provincial surveillance systems, early child development, and establishment of academic health provider facilities. She served on several business, government, and philanthropic boards, including Genome Alberta, the Canadian Institute of Health Research, Alberta Health Services, and the Mutart Foundation. The energy, compassion, intellect, and leadership that Dr. Collins-Nakai generates is not confined to medicine. She's been a strong supporter of the need for education and science and has worked to increase research funding overall in the province and in Canada. She has encouraged and mentored young entrepreneurs and has helped to promote a knowledge-based industry in the province. One of her nominators notes that Dr. Collins-Nakai is an exemplary citizen, a contributor to her community, a highly respected professional who believes in continuing education and the upward march of humanity. Today, we honor her contributions as an outstanding practitioner and as a physician leader. We recognize her as a champion for publicly funded, high-quality, accessible healthcare for all Canadians. And we celebrate her remarkable impact on improving the lives of others through volunteerism and community service. Eminent Chancellor, with great pride and respect, I present Ruth Collins-Nakai.
Eminent Chancellor, President Flanagan, Board Chair Chisholm, distinguished guests, distinguished colleagues, Dean Hemmelgarn, members of the graduating class, thank you for your generous introduction. Heartiest congratulations to the marvelous graduates of the class of 2021. This convocation is different from that you likely anticipated. It is a convocation in the middle of a crisis, a pandemic. Your last year has been one of adaptation to online learning while avoiding viral infection and focusing on trying to get clinical experiences. Crisis may force adaptation, but it also brings opportunity. The fact that you are convocating today demonstrates your resilience and your ability to change. As members of this graduating class, you're fortunate in that you have an array of choices within your profession. You can stay in one specialty and do a variety of jobs, or you can use it as a stepping stone to other careers. I remember looking after several dying children in the intensive care unit one night, exasperated that their injuries could have been prevented by seatbelts. As you have heard, together with the Medical Association, I advocated successfully for seatbelt laws in Alberta. That experience launched me into an interest in policy and leadership. It is rare that you can make such changes alone, but the voices of physicians and dentists united can make a huge cacophony unlikely to be ignored by politicians. I plead with you to advocate for the social determinants of health. The lack of food, shelter, education, dental care, and equality faced by some segments of society in the 21st century are as horrific as they were in the 20th or 19th centuries. We absolutely must advocate for our patients who are facing such miserable conditions that their health suffers, whether those patients are in our inner cities, are new Canadians, or are people anywhere living in poverty. For instance, it's apparent that politicians have been unable to solve the issue of safe drinking water for our Indigenous communities. But if healthcare professionals across the country, as a collective, advocate for this highly reasonable goal, I'll bet that we could make it happen. I admit that there were challenges being a woman in what was then mostly a man's world. But I was raised to believe that a woman can pursue any field of endeavor if she works hard, learns from her mistakes, and treats others with respect and dignity. There have also been ethical challenges for me. For instance, whether to support a young adult who had had 2 heart transplants and was now suffering rejection of her transplanted organ once again. She asked me to help her tell her parents that she was going to stop anti-rejection drugs, which meant that she was going to die. Do I respect the patient's wishes or try further treatment? And this was long before medical assistance in dying. In the end, I supported her. But it took courage because it went against the accepted norm. The message here is leadership does take courage. It would serve you well to know about leadership, as all of you are now leaders. You're in the top 1% of the population, and by virtue of your training and your Hippocratic oath, you are obligated to both your patients and to society. Whether you wish it or not, you will be thrown into leadership positions in your hospital, your dental and medical clinics, your communities, your children's schools, and in multiple places within your profession. What are the changes that are accelerating and to which we must all adapt? Artificial intelligence, robots, and digitization in your fields will dramatically increase and change your practices. You will use technologies and the various omics, like genomics, to enhance differential diagnoses, your therapies, and personalized medicine for your patients. Some of these technologies are being used now. Others are just being developed, and still others have not yet been invented. Scientific facts will continue to evolve, giving you opportunity to be creative. As long as you are practicing medicine and dentistry, you can expect to be learning and innovating. Every change and every patient provides an opportunity to solve a problem. Recently, the pandemic has increased the interest and trust of the general population in science and in medical sciences in particular. You can choose to use that public attentiveness to improve the access to and quality of patient care. Innovations that improve healthcare and the healthcare system are essential now and will depend on our current graduates to solve the healthcare woes of the public as they battle climate change, food and water changes, and infestations of various bacteria, viruses, parasites, and yes, insects. The perils of modern medicine and dentistry are that they have become much more impersonal. Knowing this, please do not forget the human, caring side of what you do, the art of medicine and dentistry. Whether it is simply comforting a patient at the end of life or explaining the details of their prognosis, there is still plenty that you can do that is the art of healing. A major ingredient of caring is communication. You are now capable of speaking in medicalese, jargon which makes you sound erudite. But these words and terms are not comprehended or appreciated by patients, families, or the public. Instead of using your words to instill a divide between you and your patients, use them to bring you closer together. Simplified language and the use of metaphors and analogies enriches your understanding and is in your control. As is the other aspect of communication, listening, a skill that takes conscious practice, especially in an environment constantly pressed for time. Given long hours of work, how does one find balance between one's professional and personal lives? How do we care for our own mental health and the well-being of the team around us? Loving your work helps. So does having a loving family or a supportive partner. In addition to a support network, looking for signs of burnout and confronting mental health issues head-on is imperative, for we cannot look after our patients if we ourselves are unwell. We are fortunate in Alberta, in fact in every jurisdiction in Canada, as there is some type of completely confidential support system for physicians. I encourage you to use it. Time does not permit me to tell you of my many adventures. I've spoken about crisis and choices, leadership and lifelong learning, caring and communication, advocacy, and innovation. I've given you examples of bias, ethical challenges, and leadership. Now it's your turn. You have so much potential and so many choices, challenges, and rewards ahead. Think, research, or innovate your way through the crises you will no doubt face. The world needs your knowledge, creativity, and resilience, not just to deal with the pandemic, but to deal with humanity's future. Here is to you, the dental and medical graduates of 2021. Thank you for giving me the honor of addressing you, and thank you to the University of Alberta for giving me the privilege of becoming a physician.
Dr. Ruth Collins-Nakai, thank you very much for sharing your story and your wisdom with our university family. You are an inspiring example of leadership, service, and accomplishment. And I especially appreciated your message that leadership does take courage, and you have shown it repeatedly through your career. Thank you so much. Thank you so much for attending and allowing us to complete this virtual honorary degree celebration. And we hope at some time in the future we'll be able to gather together and celebrate in person as we should. Thank you very much and congratulations.